Have you ever really truly stopped to think about your ears? I mean, they're these amazing, intricate, and sometimes pretty fragile structures that, let's be honest, most of us take for granted. So today, we're going to dive into what happens when the form of the ear varies, and how that has a direct impact on its most crucial function, our ability to hear. Okay, let's get into it.
All right, first things first. Just think about the actual shape of an ear. All those weird ridges and curves, that funnel-like design. It might look a little strange, but it's not random. So, what's it all for?
Well, the answer is actually pretty cool and, honestly, kind of elegant. That visible part of your ear, it's called the auricle or pinna. It basically acts like a natural satellite dish, but for sound. Its unique shape is perfectly designed to catch sound waves from the air and funnel them right down into the ear canal. And that's what kicks off the incredible journey of hearing.
So that outer design is where we're going to start. We're going to break down its basic parts so we can really understand what can go wrong, whether it's something someone is born with or something that happens from an injury.
Think of it as a three-part system, right on the outside. First, you've got the pinna, which we just said catches the sound. Then that sound travels down the external auditory canal, which is just that tube leading inside. And at the very end of that tube, you have the tympanic membrane. You probably know it as the eardrum, which vibrates when sound hits it. Sounds simple, right? But if there's a problem in any one of those three parts, it can cause real issues.
Okay, so let's start with the things people can be born with. These are called congenital conditions, and they're basically variations in how the ear forms while a baby is still developing.
And this is a really important distinction to make. See, some of these conditions, like maybe ears that stick out more or tiny skin tags, are mostly cosmetic. They don't usually mess with a person's hearing. But then there are others where the ear structure is seriously underdeveloped, and those can create a major roadblock for sound.
You've probably seen these before. These are called preauricular tags or pits. They're actually pretty common, and they just happen when the different parts of the ear don't quite fuse together perfectly during development. Usually they're harmless, but sometimes those little pits can get infected.
All right, now we're going to move on to a much more significant condition. It's called microtia.
So with microtia, what you're seeing is an external ear that's underdeveloped and malformed. It exists on a spectrum, graded from 1 to 4. Grade 1 might just be a slightly smaller ear that's mostly normal, but by the time you get to grade 4, which is also called anotia, you're looking at the complete absence of the external ear. And, as you can imagine, this is often connected to problems deeper inside the ear too.
And that brings us to atrasia. Atrasia is when the ear canal itself is either missing or completely closed off. So if the pinna is the doorway for sound, atrasia means that doorway is sealed shut. Sound waves just can't get in to make the eardrum vibrate, and that is a direct cause of hearing loss.
All right, let's shift gears a little bit. We've talked about conditions people are born with. But what about when ears get damaged by a physical injury? Now this might look familiar if you're a fan of wrestling or boxing. It's an auricular hematoma, but you probably know it as cauliflower ear. What happens is blunt trauma causes bleeding between the cartilage and the tissue that feeds it, and if that blood isn't treated, the cartilage can actually die and deform, creating that lumpy, cauliflower-like look. And it's not just cosmetic. That permanent change can make it hard to wear earbuds and even create new folds where infections can start.
So, how do they fix it? Well, the key here is you gotta act fast. The doctor will drain the collected blood with a needle, all very sterile, of course. And then they apply a special pressure dressing that's molded to all the curves of the ear. This stops the blood from filling back up and lets everything heal properly.
And then, of course, you've got cuts or lacerations. Repairing a cut on an ear isn't just about stitching up the skin. You have to be incredibly careful to also stitch up the perichondrium. That's the super thin layer of tissue that supplies blood to the cartilage. If you don't, the cartilage loses its blood supply and it can actually die, which leads to a permanent deformity.
Okay, so we've seen all these ways the ear's form can be altered, right? Now, let's make the most important connection. How do these physical issues actually affect a person's ability to hear? Let's connect form to function.
This number, it's just staggering. For every 1,000 babies born, 2 to 3 of them have a detectable level of hearing loss. It is the single most common birth defect there is, and it really drives home just how important this conversation is.
The kind of hearing loss these conditions usually cause is called conductive hearing loss. The easiest way to think about it is like a mechanical problem. Something is physically blocking the sound from getting conducted to the inner ear. That's different from sensorineural hearing loss, which is more of a nerve problem. That's when the inner ear or the auditory nerve itself is damaged and just can't send the right signals to the brain.
And this is why it all matters so much.
A child learns to talk by listening to the world around them. If they can't hear properly, it can set off a whole chain reaction of preventable delays in their speech, their language, and even their overall cognitive development. The stakes are just incredibly high.
So with all that in mind, what can we actually do about it? Let's get into our final section and look at how we find and manage these conditions.
It really all starts with awareness. Doctors and parents are on the lookout for certain risk factors. Things like a family history of hearing loss, if a baby had a long stay in the NICU, exposure to certain drugs, head trauma, and even those minor things we saw earlier, like ear pits or tags, can sometimes be a red flag for bigger issues. Because the stakes are so high, there's a whole recommended timeline for screening. It starts right at birth. All newborns get screened. Then, children who are considered at risk get a full audiology assessment by the time they're 2.5. After that, there are routine screenings for all kids at key ages all the way through their school years, just to make sure we catch anything that might show up later.
And this one quote from the research really just sums it all up perfectly. Everything we do, from understanding the anatomy to spotting risk factors and doing screenings, it's all built on this one simple idea. Early detection is the absolute foundation for a child's ability to learn how to communicate with the world.
So, I'll just leave you with this question to think about. We've talked about anatomy, trauma, and medical procedures today, but at the end of the day, it all comes down to a simple, painless test. A test that can find a problem and open the door to solutions that can literally change the entire course of a child's life. It's just a powerful reminder of how deeply our form, our function, and our future are all connected.